Hello and welcome back to the training room. This is Chuck Weaver, National Director of Training and Recruiting here at Association Member Benefits Advisors, and today we're going to be talking about Medicare Part A only. Let's jump right into it. Let's talk about how Medicare Part A is premium free. To qualify for premium free Medicare Part A, you have to pay FICA taxes. What does FICA stand for? The Federal Insurance Contributions Act, where a person or their spouse pays FICA taxes for 40 or more quarters, and then this qualifies the individual and their spouse for premium-free Medicare Part A. So one spouse has to pay 40 or more quarters of FICA taxes. There are two other groups that will qualify for premium-free Medicare Part A, and these are going to be people who have received Social Security or Railroad Retirement Board disability benefits for 24 consecutive months, or have end-stage renal disease. Now, our market is going to be primarily people turning 65 that have paid in FICA taxes, but there is if someone didn't pay in their FICA taxes, they can qualify for Medicare Part A, or they can receive Medicare Part A, I should say, by paying a premium of $411 each month. Medicare Part A pays on assignment. What is Medicare assignment? Medicare assignment is a group of codes. They're called ICD-9 and ICD-10 codes, and each code has a dollar amount that Medicare will reimburse the provider for each ailment. So when doctors say they're going to take Medicare assignment, what they're saying is we're going to take what Medicare pays as paid in full, and we are not going to charge anything over that. What does Medicare Part A cover? Medicare Part A covers hospital expenses. You don't want to overthink Medicare Part A. All you really have to understand are the deductibles, because that's where our retirees are exposed to thousands of dollars each year just on hospital stays with their deductible. So Medicare Part A covers hospital expenses after you pay a $1,288 deductible for each benefit period. What is a Medicare Part A benefit period? A benefit period for Medicare Part A ends after you have been out of the hospital for 90 consecutive days. So 9 times 4 is 360. You have the 1 day in would be 364. So each Medicare beneficiary has an exposure to 4 benefit periods each year where they will pay that deductible, $1,288, 4 times. It could be that's their maximum exposure. So it could be $5,152 per year in Medicare Part A deductibles alone. Now, Medicare Part A covers hospital expenses, but this is where they're also going to get benefits for skilled nursing facility care and hospice care. Now, after they pay the deductible, what else is Medicare Part A going to leave up to the retiree? It's going to be all but the first 3 pints of blood. Now, for extended hospital stays, that's going to be days over 60 days. There are co-payments as well. 61 through 90 is going to be $322 per day. 91 through 150 is all but $644 a day. And if someone does not have a Medicare supplement, that is where their benefits end. So any stays over 150 days will be straight out of their back pocket. That's why people enroll in Medicare supplement insurance plans. Now, Medicare Supplement Plan F and G are the plans where the retiree is going to have nothing left over as long as they go to a hospital that accepts Medicare assignment. So, both pay the Part A deductible for every benefit period, leaving nothing left over. Both pay the co-insurance for extended hospital stays. Both cover the first 3 pints of blood, and both will pay for extended hospital stays of 151 days or more. What is the difference between Medicare Supplement Plan F and Plan G in regard to Medicare Part A? Medicare Supplement Plan F and Plan G pay the same for Medicare Part A. The difference between the two lies in what they will pay on Medicare Part B, which we will go over in another slide presentation, and that's going to be that deductible of $166 per year. Plan F pays that, Plan G does not. So in conclusion, keep it simple. Medicare Part A, the exposure to the retiree is going to mainly lie in the deductibles for hospital stays, where they pay a $1,288 deductible for each benefit period. Benefit periods start over once the retiree is out of the hospital for 90 consecutive days, and they are exposed to 4 of those in a calendar year. So thank you for participating in this AMBA Medicare Part A training.